Social work has historically has not received the respect or the funding that it deserves. It didn't receive the recognition of the work that it did with very challenging people in our community, and so it was a low-paying position. There was a time when social work wasn't real attractive to the student, and so we've seen those entering that field of practice reducing. And then right around the corner, we've seen expanded healthcare come. So we've seen people who historically had not had access to public health care. Now millions of people had access to health care. So all of a sudden you have health care and you want to go attend to your depression or your anxiety or your social phobia or your marital challenges or your child's behavioral issues. So we had an influx of people coming to the front door, and we didn't have the professionals there to serve them. And the stigma is reducing around mental illness and substance use. And so people are really reaching out to try to become healthier, and we didn't have the workforce. We were not prepared to receive them. And so we're doing a lot of workforce development efforts to try to encourage students to engage in this profession. We're doing internships, externships, scholarships. The state of Ohio just recently put out funding. We're helping our professionals learn how to use the professional shortage healthcare opportunities and student loan repayment programs, and we're doing everything we can to make it more attractive for people to want to come into this field and serve others. So it was a timing issue. We've got a lot of efforts going on at the state level, a lot of efforts going on locally, and hopefully we'll see relief, but it's not coming tomorrow. And so we acknowledge that there are some services that have suffered as a result of that. The demand is greater than the supply, and that's unfortunate, but we're doing our best to address it in 150 other ways. We've added paraprofessionals, we've added additional levels of professionals into our field of practice to try to help serve and fill the gap and meet people where they are.